Then there's California, a podcast featuring members of the California State Senate Democratic Caucus in conversation about their legislative priorities, policies, and other related issues that help make California exceptional. From the state capitol in Sacramento, I'm Brian Green. There were many life-changing scenarios and precarious, even life-threatening inflection points that we have all been through during these past 11 to 12 sobering, despairing, fever dream COVID months that have made us stop in our tracks as Californians, as human beings, and think about the whiplash, chaos, and the fragility of the world that we live in. But with more than 25 million U.S. cases of COVID reported and more than 400,000 COVID-related deaths as we speak, when the amazing sun-will-come-out-tomorrow news was announced in late December that safe, effective vaccines had been developed and were ready to be released, there was this huge, audible, societal sigh of relief as we all realized that science and urgency had ultimately triumphed over demagoguery about bleach injections, and that the end of the road for this pandemic was starting to look like it was in sight. A COVID vaccine in less than a year. Remarkable, with expedited testing and clinical trials, and it just seemed like a miracle. But 90 days, 2 months later, well, reality is kind of creeping in. On this edition of Then There's California, we'll talk about the efforts to bring a much-needed COVID vaccine to a pandemic-weary California, the challenges of scheduling and prioritizing vaccine access, and what's ahead in an inoculated 2021, or maybe 2022. And can enough people be encouraged and educated to a point where they see truth when health experts claim the vaccines are here, so trust the science and step up? But important questions remain. Is it safe? Is there enough of the vaccine? Will the people who need it the most and the soonest have priority access? And can we get to a collective point where all agree that getting a vaccine will protect and prolong health, and we can begin to return to a life where we can be with our loved ones and hug each other and go to school and go to work and museums and sports? And, he says selfishly, we don't have to keep our podcast guests socially distanced, and we can talk in person instead of over the phone. If you live in California or somewhere across the globe and you follow health-related or vaccine-focused news, you can't help but recognize the name of Dr. Richard Pan. Dr. Pan is a pediatrician who also runs a family dental practice in Sacramento, and he is the state senator representing the 6th Senate District here in Sacramento County. In the new legislative session ahead, Dr. Pan picks up where he left off in his public policy leadership priorities, continuing as chair of the Senate Committee on Health, and he also serves as chair of both the Senate Select Committee on Asian Pacific Islander Affairs and the Asian Pacific Islander Legislative Caucus. He's also a member of the Special Committee on Pandemic Emergency Response. Senator Pan has also been a guest on this podcast a couple of times, talking about health issues related to children and the controversies and medical priorities related to vaccinations. Joining us by phone and safely socially distanced at his home here in Sacramento, Dr. Pan, glad to have you back on Then There's California.
Thank you. Thank you, Brian. Great to be back with you.
And Happy New Year. I guess it's not too late into the new year to say Happy New Year.
Yes, Happy New Year. And also looking forward to the next Lunar New Year in February, the year of the ox. Slow and steady, but more steady than slow, I think, was what we're looking for.
I appreciate allowing us to reflect on the year of the ox amongst all the other crazy stuff that we're going on. It just brings a little peace of mind even in reflecting on that. Yes. That's great. How are you doing, by the way? How is your family?
Well, I have to say, certainly our family has been fortunate that we've been able to continue our work, continuing to do well and been able to avoid the virus. But at the same time, certainly personally experiencing some of the struggles my constituents have been struggling with. My children are distance learning from school and public schools, and that's been a challenge for students and teachers alike. My kids miss being able to see their classmates. My wife's a small business owner and had to shut down in the spring, and of course wanted to be sure her employees were taken care of and has to meet payroll and pay bills as well. So that's certainly been a challenge. And I have relatives as well, some of whom are high risk, and want to be sure that they're staying safe as well. And frankly, we all miss being able to see each other in person because
Absolutely.
We want to stay safe. And that's something I know many people struggle with, right? You want to try to take care of your loved ones, take care of your friends, but you also miss being able to be close to them during this pandemic.
In several of the COVID-themed podcast conversations that I've had with your colleagues here in the Senate over the last several months, they have shared their views of how 2020 unfolded in their districts and their communities, the abbreviated legislative session of last year and all of that. But you have a particularly unique perspective with your dual vantage point as both a lawmaker, but also a physician. So from your lens as a pediatrician, as a senator doctor, how did things go for you in this last year?
Well, we were able to get much of the work done that we needed to for the people of California, but at the same time, we struggled against the virus and also against divisions that are in our country and our state, where unfortunately there was mixed messaging about public health measures. You had people come to the Capitol to essentially protest any effort to stop the spread of the virus. They were against masks. They were against testing. They're against contact tracing. They're against physical distancing. And unfortunately, what we know about contagious diseases is that even when a majority of us are doing the right thing, a small number can ruin it for the rest of us. And unfortunately, we've seen the impact of that. Although I would say overall, I want to really thank many of my fellow Californians for doing the right thing. We were able to get through the spring without having large outbreaks like we saw in the rest of the country. But as you know, the holidays rolled on from Memorial Day to July 4th to Labor Day to Thanksgiving to Christmas, I understand people got a bit tired, and there was probably more traveling than perhaps wise, and we saw continuing spikes in cases. And unfortunately, we also then saw the impact on our hospitals and unfortunately on deaths as well.
There are no true words to adequately describe what we have been through since last spring as a global community and as a country and a state. And I kind of laugh at the quaint notion we were all thinking of last spring when we were, don't worry, this will all be over soon. We'll be back to normal by summer. Well, another summer's approaching, and we'll be lucky if we get to something resembling normal by summer of 2021. Again, from your medical practitioner lens, including some of the reflection you've had here about some of the opposition and the pushback, what's your take on how California and the U.S. has handled the COVID pandemic and how we're dealing with it now coming into 2021? Did you have your own suspicions that we wouldn't be going back to normal anytime soon?
Well, unfortunately, I did have suspicions we weren't going back to normal soon because I saw how divided the response was, particularly at the federal level. I would keep in mind that any contagious virus, including this one, takes advantage of any vulnerability that is given to it. The virus, it doesn't have a brain. It's just relentless in trying to exploit any opportunity it can to spread.
Absolutely.
And so we've seen other countries who've been able to stop the virus. So we look over at places like Australia and New Zealand. We look at Taiwan. We look at South Korea, all democracies, all countries which had the political will to follow the science and to ensure that their citizens were safe from this virus. And frankly, people over there are going to restaurants. Their kids are going to school. We could have had that here in the United States if we were able to all agree that we should follow the science to make the choices to contain and stop this virus instead of turning it into a political football and wearing masks and other basic public health measures as being political statements.
And thankfully, California's administrative and public health leadership is pro-science without hesitation. And now, doubly thankfully, the Biden administration taking over in Washington, too. And it seems like trusting the science and the facts are starting to become more of a reality for all of our lives and thinking than they were even just a couple of months ago.
Well, certainly I appreciate that President Biden has put together a team that is focused on the science, that we have people like Dr. Fauci who continue to speak out about what needs to be done, and the leadership we've had here in the state of California in terms of trying to, again, articulate the science. But I would also remind people that it's not what the government's telling you, it's what you choose to do and how each of us choose to respond. This is about personal responsibility for not only yourself, but for the people around you. So when someone decides that they're not wearing a mask or they're having a gathering with too many households, that is a decision that has a tremendous impact on the rest of us. And so I do want to be clear that while certainly we need to have a science-based leadership in government, and the fact that we had mixed messaging caused a lot of problems, ultimately the success or failure of any of our interventions to stop this virus depends on what each of us decide to do, whether we're going to listen to the science and follow through on that or choose not to. And that will have a profound impact not only on ourselves, but on our entire community.
You mentioned Dr. Fauci, and I just have to ask, has it been interesting for you after the inauguration of the Biden administration, the new lease on life that Dr. Fauci seems to have now as a fellow physician? Did your heart break for Dr. Fauci in 2020? Did it look like he was trapped in a bad marriage, having to put his science aside and just go with the rhetoric of the day? What did you think about that?
I think that it was terrible that experts like Dr. Fauci, that the best public health agency in the world, the CDC, were sidelined for so long. And not only sidelined, I find it appalling that Dr. Fauci needs Secret Service protection because there are people who are not only threatening his life, but his family's life, because he is willing to stand up and speak out about the science. And I think that says something about the state of our country that we need to address. You know, we can certainly disagree and we should debate, but when people resort to violence as a way to impose their ideas or their beliefs on the rest of us, that should not be acceptable. And unfortunately, it's not just Dr. Fauci. We saw that happen to our local public health officers here in the state of California, where many of them were not only attacked in the Board of Supervisors chambers, but we had people go to their homes and threaten their families as they're on the front lines trying to stop this pandemic and, frankly, speaking truth to power, trying to educate people about the nature of this pandemic and what needs to be done to stop it. And yet we had people trying to bully and intimidate them to keep them silent so that they would not be able to do their jobs.
A threat you know too well.
Yes, unfortunately, that is true as well. And I think when we think about vaccines, and you talked about vaccines, and by the way, as I was talking about this, notice I haven't talked about vaccines yet, because those countries like Australia, New Zealand, and Taiwan, they stopped the pandemic in their countries without a vaccine. It's not that they have a vaccine and we don't, right?
Right.
So we certainly have new hope with a vaccine, but we still can stop the pandemic even without the vaccine if we wear our masks, keep our distance, avoid mixing households. Those things alone, combined with sufficient contact tracing and isolation of people who have the virus and support for those families so they can follow through those public health measures, those are the things that can be done to stop this virus. And in fact, should be done because it will take us a while to get everyone vaccinated.
Well, let's talk about vaccinations. Thank you for that great segue. And as I mentioned before we started, Dr. Pan, contrary to what some in the press might say or some who spend time on social media might say, there is more to your expertise, more to your curriculum vitae than just a dialogue about vaccines. But I'm glad that we have you here to give a perspective on this important stage of our journey. So let's talk about the rollout of the COVID vaccination plan. And again, as I mentioned at the outset, we all experienced this collective sigh of release at the end of the year when the news was announced that safe, effective vaccines against COVID had been developed. It was like manna from heaven, like, oh my gosh, what a release. We can see the light at the end of the tunnel. But 90 days, 2 months later, as we speak, reality has creeped in. Kind of a chaos theory has grabbed hold, and this miracle of vaccine seems more of a complication. And so here we are, early February. Only a small proportion of the population are eligible to get the vaccine, and many of those people haven't been able to line up appointments. From your vantage point, again, as a lawmaker and a doctor, how has California been handling this vaccination rollout so far?
It's interesting as you talk about this, I think about my own career trajectory, because when I decided I wanted to go into medicine, and I went and I majored in biophysics in college and worked in a lab first, because I thought my career was going to be about inventing the next great cure, right? You know, certainly there are a lot of diseases out there which we still need to learn more about. In fact, scientists every day are developing amazing treatments. And think about the fact that we were able to develop a vaccine against this novel coronavirus in less than a year.
So quickly, yes.
So quickly. But one of the things I also, as I was going through my own career trajectory in medicine, was that certainly we need people who continue to go into the biomedical sciences and develop those new vaccines and treatments and cures. We also need to realize that a treatment or a cure is no good when people can't get it, right? You can invent it, but if people can't get it, and that you need to spend as much time and effort figuring out how do we get it to people, how do we be sure that it's accessible to all people, that there's equity involved, that if you're really going to make a difference. And so when this vaccine was being developed, the federal government invested a lot of money to make it happen. It is a miracle of medical science that we were able to develop the vaccine so quickly, although I would point out to people, because some people say, well, gee, this is such a quick development. That was based on technology that had been developed for more than a decade. So it's not something that we just invented out of the blue. That actually speaks to our investment in the basic sciences that we were able to develop the vaccine so quickly because we put all the other pieces together over the past decade. But what we didn't do at the same time, while the federal government was investing so much in developing the vaccine, was actually to spend at least some effort and money to figure out, once we invented it, how we get it to people. In fact, the Trump administration actually lobbied against giving money to states.
I saw that story this week.
Yeah, local governments to distribute the vaccine. And getting vaccines to people is actually not a simple process, because in order to ensure that the vaccines are still effective, there's supply chain issues, there's cold storage, then you also have data tracking. All those things take time and money. And in fact, as a pediatrician who gives out childhood vaccines, most people don't realize, but giving vaccines is a big deal. So in a pediatric office, we have to store them in a refrigerator. We actually have to record the temperature on a regular basis and ensure that the temperature is appropriate. In fact, if it goes out of the temperature range, we have to throw out all the vaccines in that refrigerator. You have to record every lot number that you received, that you distributed. There's a huge thing that goes together in terms of delivery of the vaccine to ensure that not only people get access to the vaccine, but that we can track it, we can track safety, all these things. And that's for your typical vaccine. So when you get your flu vaccine or your kids get their vaccine in their doctor's office, there's a lot of stuff that goes on in the background that, you just see your kid getting the vaccine. They're like the nurses is tracking and recording and keeping records and so forth like that. So same with COVID, so that we can track if in case anyone has any reactions, to be sure that people are getting the right number of doses, and that all takes time and money. And we need IT systems and so forth. And frankly, there's been almost no money for that until the last stimulus package, which was just signed, I think, a month ago.
Right.
So we didn't put effort into giving resources for distribution. Now, the state developed some plans, but that's in the absence of having any resources to execute it from the federal government. Plus, by the way, when they were developing the plans, we didn't know which vaccines would be approved yet because they were still under trials. So you had a lot of missing information still. So, yes, we should have spent more time and effort figuring out how to distribute the vaccines and getting the resources necessary to set up the systems in place so we could do it more effectively.
There is so much to talk about on this issue, and I realize I have to be careful to not go too much in the weeds because it's such a fluid, shape-shifting debate and discussion and process that what we talk about fresh on this Monday as we speak could be old news by tomorrow. But there's plenty to talk about, in particular California's vaccine schedule. As the vaccines started to arrive in California, it was determined logically that first responders, doctors and nurses and other healthcare practitioners would be and were the first to roll up their sleeves for this, followed by, in theory, elder care practitioners, people working nursing homes. And now the protocol is prioritizing those 65 years of age and over. Again, that makes sense. Who do you think should be next? Should it be persons with disabilities, teachers? We want to get those kids back in school, prison inmates. I mean, there's valid science and health-centered arguments for prioritizing any of those populations.
So a couple of things to keep in mind. First of all, we don't have enough vaccines. So first thing we got to do is up the supply, right? Because we can prioritize people, but if we don't have enough vaccines, we're not working through the priority list very quickly. Second of all, in order to effectively move vaccines out, we have to be sure we keep it simple for the people on the front lines. So if you're the pharmacist or the doctor or the nurse giving the vaccine, you don't want to be having to hand someone a 2-page questionnaire to ask them all about their occupation and their date of birth and everything else, and then say, oh, well, sorry, you can't get the vaccine today. Go away, come back. I don't know when because I'm not sure when I'll get enough vaccine before we get to you. We have to keep it simple on the front lines. What we do have to do is look at how we deliver the vaccines in a way and distribute the vaccines in a way that assures equity and that we prioritize people at the highest risk. So that has to do with the way we organize our distribution and also how we prioritize notification of people to get them in for that. So certainly I think that it was important to talk about prioritization. At the same time, we want to be sure that we keep it as simple as possible for the people on the front lines so that we're not finding ourselves in a position where we have a lot of vaccine doses that are in storage that we're not delivering because people on the front lines are having challenges deciding who gets the vaccine and who doesn't, especially in the face of a shortage. So we instead should need to be working on strategies to get vaccines to people in locations and in ways that ensures that we have more equity. Because after all, we know that, for example, African Americans and Latinos are much more likely to get the virus and die, and Pacific Islanders as well. We also know that people are working in essential worker positions where they can't stay home. Because remember I said one of the things we ask people to do is stay home. Well, if you can't stay home, you're at high risk, right? So if you're doing something essential like getting food to people's tables or being sure that other types of infrastructure are maintained and you have to be exposed, or healthcare workers, right? If they all stayed home, we have no one taking care of people in the hospital, in the emergency room, then they need to be sure that they get vaccinated to both protect themselves but also prevent them from catching the disease and spreading it to other people.
Well, we're also hearing stories now about vaccine disparities, the racial disparities, equal to what we saw manifested in the testing and protection from COVID and in COVID sickness, and now repeating themselves in the vaccine stats. A racial gap has opened up in the nation's vaccination drive, with African Americans in many locations lagging behind in receiving the shots, in some cases significantly lagging. I guess, why do we keep reflexively falling back on these biases and leaving people out, and this caste system perception that we have in our communities over and over again about who has access?
Well, a lot of it has to do with structural racism, but basically the infrastructure that we've put together has led to these disparities, and as well as disparities in other areas as well. So let's just talk about vaccinations. So remember I talked about, okay, we're going to try to achieve equity, we need to be sure that we get the vaccines to places where people are. Now, if you're living in a low-income neighborhood, you're actually probably less likely to have as many pharmacies and doctor's offices and clinics than someone in a more well-off neighborhood. So you develop a vaccine distribution system that depends on those pharmacies and doctor's offices and so forth, and you have fewer of those in your community, is more likely that there'll be less access in your community than another community that has more access to those types of facilities, right?
Right.
So we've built it in. We've baked that into the way we've done things. And that's why when we approach the distribution of the vaccines, we have to think about innovative strategies. By the way, the very pharmacies that are in low-income neighborhoods oftentimes have fewer resources than pharmacies in better-off neighborhoods.
True.
So their ability to handle, again, a complex substance like the vaccine, which requires, the current ones that are approved require cold storage, they need more help in being able to accommodate all these things so that they're able to deliver the vaccine. So that's part of what we need to look at. Also, we need to think about alternative distribution mechanisms as well, because the existing infrastructure may not be sufficient. At the same time, and this is why I'm doing a bill on addressing racism as a public health crisis, is that it's not just about COVID. We need to address this in the long term. So yes, COVID is an immediate issue, and people are dying of COVID, and we need to address it now. But we also, when COVID is over, and it will be eventually, I mean, the virus may still be hanging around, but we'll get vaccines and so forth, that we don't then say, oh, now that it's over, we're not going to address the underlying problems that led to these communities being farther behind during the pandemic.
Exactly. And that's what allegedly 2020 was supposed to have taught us, that the COVID scenario brought into full relief these disparities in our community, and we're supposed to be learning from that.
Yes, and that's why we need to have this conversation. And, of course, last year wasn't just COVID. It was also the people standing up and saying we need to address systemic racism, we need to address criminal justice reform, and other issues, disparities that are leading to higher death rates, higher rates of illness and injury among people of color and people living in communities of color.
Have you been vaccinated?
I am in Category 1A as a healthcare worker, so I have received my first dose of the vaccine. So I'm still waiting for the second.
Any side effects?
No, I think a little bit of a sore arm, and that was it.
Great. So you eagerly will wait for that second vaccine, and then you can be an additional testament to how this works and the efficacy of this process for all of us.
Of course, yes. and you know, I think we talked about the challenges of actually distributing the vaccine, but the other piece that we haven't touched on yet is, so what happens is that someone's invented the vaccine, now we need to get it to people, but we also need to invest in educating people about the vaccine itself so that they understand what the vaccine does and why it would be important for them and their families in making a decision to get the vaccine. So that's the other part. We haven't invested as much either. So I talked about how we haven't invested a lot of resources on the distribution. We need to invest more in also educating people about the vaccine. It's a new vaccine. We're trying to vaccinate a lot of people with it. Right now, we don't have enough vaccines for all the people who want it, but eventually we're going to get to a point where there are people who have questions about the vaccine that we need to answer, right?
Right.
So when people have legitimate questions, we need to give them an opportunity to answer those questions. And talking about systemic racism, that history is not something that people will forget, nor should they forget. And so there are communities that are more skeptical about the vaccine, but have honest questions, and we need to be sure they're answered. At the same time, unfortunately, we also have to deal with people who they're not interested in honest conversations about the vaccines, and instead they've resorted to spreading lies about the vaccine. They may even personally profit from that. They're out there trying to generate anxiety and doubt about the vaccine, and we need to be sure we address that as well. So one of the things that I'm also working on is we're trying to encourage people, as people are waiting for the vaccine, to pledge to get the vaccine. I think it's important for people to know that the people who are around them in their community want to get the vaccine, that they're listening to their doctors and other health professionals, and choosing to get the vaccine when it's their turn, and that we need to create a movement around that. Because too often, for most of us, getting a vaccine is pretty straightforward. It's common sense, right? So it's not something we talk a lot about. Yeah,
right.
I got my vaccine. It's not something I talk about on social media or so forth. But the people who try to discourage vaccinations are oftentimes very vocal about that. And so we need to change that dynamic, because the vast majority of people want to get the vaccine. They know that the vaccine is something that will keep them and their families and their communities safe. And so we need people to say, yes, I am going to get the vaccine when it's my turn, or I've gotten the vaccine. And I know that there's been an initial movement of physicians and other health professionals who have done that on social media, showing pictures of themselves getting the vaccine and announcing they've gotten the vaccine. We need to build on that so that people will know that many of their friends and family members and people in their community have looked at the information that they're choosing to get the vaccine. And then we need to give them people the opportunity to ask questions, legitimate questions, so they can get those answers, so they can make the right decisions for themselves.
And you're bringing up something that reminds me, I saw a news story recently about what is now called a growing vaccinated class, a prestige claim. In fact, one of the dating sites has said that getting a vaccine is actually the hottest thing you could be doing on your dating app right now, is to say, I'm a Taurus, I love long walks on the beach, and I'm vaccinated. Make it cool. Make it cool to be vaccinated.
Well, let's go this way. A person who chooses to get vaccinated is someone who not only cares about their own health, they care about the health of people around them. So frankly, I think that's a baseline thing you should be looking for when you're looking for a mate, someone who actually cares about more than just themselves.
Right. Well, despite all this drama, about availability and schedules and the efficacy of it, the opportunity to be part of a vaccination process in the wake of such a devastating pandemic should be a lesson in patience and in gratitude. It's your job to at least help save your life, prolong your life and the life of your loved ones. And getting an appointment may be a pain, but try to get one. Be patient. And in the meantime, be kind with each other.
Yes. No, we should certainly be kind with each other. We should be patient. People have questions. Let's give them answers. So we want to answer people's legitimate questions. And also, by the way, we ought to make it easier for people to sign up for the vaccine. And I do appreciate that I've been working with the administration. The administration, we're setting up My Turn as a way for people to sign up for the vaccine. We want to be sure it doesn't crash when people are signing on.
Well, right now it's exclusively San Diego and L.A. County as we speak, correct? And then it's supposed to be unveiled statewide? It
is being piloted in Los Angeles and San Diego. And the reason we're piloting it is to be sure that it's robust enough. And, L.A. is one of our biggest counties. So as we spread it across the state, which it will, that we will have a mechanism by which people can sign up and be sure that they will be notified when there's an opportunity for them to get vaccinated.
I want to address, again, as you have mentioned, and you have spent your life over the last couple of years marinating in all of this, addressing the element of this vaccination process you are all too familiar with, the anti-vaxxers out there. You not only have the viral nature of the pandemic, but you also have this viral nature of this crazy belief system, as you have mentioned and dealt with, that vaccines are evil, and the threatening pressure and conspiracy mentality in all of this. You can connect the dots from the anti-vaxxer attitudes about school children's vaccinations to the outrage over wearing masks to now the conspiracy behind the COVID vaccinations. And Bill Gates wants us to be vaccinated so he can implant microchips in our bloodstream and turn us all into socialists. So we have this raging pandemic, a vaccine that's 95% effective at keeping you from dying, and a social media-driven refusal to accept science. And as we saw this past weekend, as we speak on the news in L.A., of the anti-vaxxers that sabotaged and disrupted the vaccination clinic at Dodger Stadium, and I know you reacted to that. As a doctor, as a lawmaker, as a father, as a civilized human being, you must be so pissed off at this deja vu, this element of this coming up over and over again.
The anti-vaxxers like to say that it's about their rights and freedoms, yet why were they there at Dodger Stadium taking away the rights of the people who wanted the vaccine from getting the vaccine? Those people waiting in line wanted the vaccine, right. And these extremists tried to stop them from getting the vaccine. They tried to take away their choice and their rights, and they're taking away all of our freedom from this disease. And so that's a problem because they are trying to keep us from being free of this pandemic. And in fact, some of them have even said, not specifically the people necessarily at the stadium, there have been leaders of the anti-vaccine movement who've said that we want this disease to spread. We want everyone to catch it. And the people who die, it's their fault. They made bad health choices. And unfortunately, also, many of them have aligned themselves with other conspiracy-minded people, including QAnon, including white supremacist groups as well. And we need to reject those lies, and we need to reject that kind of false beliefs. We see what's been happening not only in terms of the violent actions of the anti-vaxxers. So, back in 2019, one of them assaulted me on the street. Another one threw blood on the Senate floor.
Yes.
They've attacked local public health officers. We heard about a pharmacist in Wisconsin who intentionally spoiled vaccine doses, who believed in these myths like the vaccines are microchipped and will cause infertility, which are all false. And then, of course, we have the extremists who obstructed access to the vaccination site in Dodger Stadium. This goes beyond saying that they're opposed to the vaccine. They're actively trying to harm other people. And we also need to think about the role, unfortunately, social media has played in giving them a platform for doing this. The act in Dodger Stadium was organized on social media and was communicated on social media ahead of time. We know that many people have been drawn into conspiracy groups because they've been recommended by algorithms on social media. And so that creates a challenge for those of us who are trying to encourage people to do the right thing. So when we think about vaccines, I talked about the importance of educating people about vaccinations. Well, let's not just talk about COVID vaccine. When we talk about ordinary childhood vaccinations, what we know is when people have a chance to talk to their child's doctor about vaccines, a vast majority of them, in fact, vaccination rates for children are above 90%, that they are persuaded to do so. And some person may say, well, what's the problem? The problem is that the surveys of pediatricians have found that pediatricians have to spend approximately 20 minutes debunking all of the myths the parents have heard that's made them anxious about the vaccines before they make that decision to vaccinate. Now imagine you take 20 minutes of a doctor's time, the value of their time multiplied by all the times they have to do this over and over again. And so instead of being able to spend time talking about child's development, about their nutrition, about other types of issues, they have to spend time debunking lies and myths that people are being fed on social media. That's a tremendous use of resources. That's a huge amount of resources. So
Absolutely.
When we think about what we have to put into educating people about the COVID vaccine, think about how much of it will have to be spent basically trying to debunk myths that social media companies have profited from platforming. And that's going to be taxpayer dollars. That's your healthcare premiums. That's a lot of resources.
True. Obviously, including the time spent debunking and getting enough vaccine and getting people scheduled. This COVID vaccine rollout is going to take some time. Mm-hmm. What should we do as Californians in the meantime to keep safe? We are not going to return to pre-pandemic life right away. So even after we have been vaccinated, what should we keep doing? What can we feel free to do finally?
Sure. The vaccine is not 100%, nor is anything else in the world 100%.
Indeed.
So as long as we still have a lot of the virus in our community, it's still important that we continue basic public health measures, whether you're vaccinated or not. That is wearing a mask, keeping that physical distance from people who are not in your household, trying to stay home as much as possible, because we need to reduce the amount of virus in the community. And by the way, as long as there's a lot of virus out in the community and a lot of people are getting sick, that also means we've increased the odds that we're going to have new mutations and variants of the virus. And one of the concerns that's out there is that the virus has been spreading, that we're developing variants in which our immune system may not be as effective in fighting off, even if we had a previous infection. So people are getting reinfected with the virus. So we
Right.
need to reduce the opportunity of the virus from developing new variants by getting the number of people who are infected way down. And so that means wearing your mask, keeping your distance, staying at home as much as possible, and when the time comes, getting vaccinated. It's been estimated that we'll probably need to get, well, originally people were talking about 70%, but with some of the variants now they're talking 85% of people vaccinated, where we have enough people vaccinated that the virus will have trouble spreading on its own because of all the vaccinations. But it's going to take a while for us to get there.
And I saw a poll recently that said 71% of Californians want to be vaccinated. And that was a couple of weeks ago, but we obviously still have a threshold of Californians we still need to convince.
Yes, and I should also keep in mind that right now the vaccine isn't approved for children. That's about 20% of our population. We hope that will be the case by the summer. So when we're talking about getting 85% of people in California vaccinated, that's everybody. That includes the children, too. So we do have some work to do, but in the meantime, people still need to wear their masks. We're going to have holidays eventually come up. Memorial Day will come up again in May. July 4th will come up. People planning on doing a lot of travel. We don't want to have a spike. Hopefully by the summer, we'll be well on our way in terms of vaccinations. And maybe by the fall, I'm going to be an optimist here, by the fall, our kids are going to go back to school and we can let our guard down a bit. But certainly this spring, let's not let down our guard. Let's be sure we try to drive down the amount of virus in our community as we're trying to get more and more people vaccinated.
Well, to that point, what do you think normal will look like once vaccines become routine? And I think we're all becoming convinced that normal post-pandemic will look and feel a lot different than normal pre-pandemic.
Actually, some of the things that we've had to do for the pandemic, some people may actually want to continue doing some of those. So we may see more people working remotely in certain types of jobs. Telehealth is probably going to be here to stay for some things because of the convenience. But I'm also hoping that, for example, distance learning may have worked for some students. It hasn't worked for a lot of students, and we want to try to return back to in-person learning. As I mentioned, there are still a lot of jobs where people can't do it remotely, and there's other jobs where that's going to work out better. We'd like to see people to be able to go back and be together, visit each other, travel more, eat at restaurants. So hopefully those are types of things that we can go back to. You know, wearing masks is turning out to be good not only in stopping COVID, but some other respiratory diseases as well. And in fact, in certain parts of the world, people don't bat an eye about mask wearing. So there may be some people who say, you know what, we should keep doing it every winter and fall when we have other viruses around as well, because that's been useful in trying to reduce those viruses, those types of diseases as well. But certainly mask wearing is something that is extra important now while we do have the COVID pandemic. Later on, it's probably going to be more of an option that people will recommend that more people do than we've done before the pandemic.
Well, I appreciate that projection and that assessment here. And Senator, just some final thoughts. I had read this recently. 2020 was a year that, as one commentator put it, broke the truth. That 2020 was the year when millions of Americans all of a sudden seemed blind and impervious to evidence and willing to believe the most outlandish things if it suited their biases, and eager to make enemies based on crude stereotypes, and that 2020 was the year that we called into question the very protocols by which our society makes progress. And we've learned that many of our approaches to changing minds and behavior and reestablishing trust are flawed, beginning in this third decade of the millennium. And it's even reached an extreme where even you, Dr. Richard Pan, a noted medical practitioner, a pediatrician, a lawmaker, a public policy practitioner, can share valid science-based facts with someone and try to explain to them perhaps that what they think are facts are not. And instead of winning them over, you risk simply entrenching their false belief. 2020 showed us where these divisions are and even gave us examples of how to fix it. Considering all this, can we do it?
Well, that is a really important question at this juncture in history for our country. Are we committed to continuing our experiment in democracy that was started back in the late 1700s do we all value each other as Americans first, or do we give in to people who wish to divide us, whether they're foreign or domestic? Because there are people who profit from division. So we have to decide as a country, do we come together around things like facts? Do we have things we have in common with each other that are more important than the differences between us? Because if we can't even agree on what's reality, then it's very hard for us to work together to not only stop things like the pandemic and other types of attacks against our country, it's hard for our country to be able to move forward. And I think we need to really examine what are the sources of our division, and can we all agree to overcome them together.
How beautifully and soberingly put, Doctor. I appreciate your response to that. You mentioned earlier in your career you were looking for the next great cure. Here in this part of your career, you still want to try to find the next great cure?
Well, I'd like to say I went from the micro to the macro. Micro being like, okay, let's figure out whether it's the biomolecular source of a particular disease to, well, how do we be sure people get access to the treatments that they need? How do we be sure people get access to the prevention, to the services they need? And so without that, all those cures don't matter.
Well said, sir. Senator Pan, thank you so much for your practitioner work, and stay safe, and we'll hope to see you in person sooner than later.
Thank you so much, Brian. Really appreciate talking to you.
Same here. Dr. Richard Pan from Sacramento, a state senator. And that is a wrap for this edition of Then There's California. It's a production of the California State Senate Democratic Caucus, with technical assistance and great ideas and support from Martin Ashley, Bob Brulte, Brian Shadden, and Rainier Saviniano, McLeana Woods, Martin Bowie, and the graphic design talents of Tim Davis. On behalf of Dr. Richard Pan, State Senator from Sacramento, I'm Brian Green. Stay safe, everyone, and thanks for listening to Then There's California.